All right, let's begin. Finish up the hormones of pregnancy. And then I want to quickly review seizures. We've drilled this several times in class, but at the end of neuro, to show you how to organize it. All right, here we begin. Let's go. First hormone is produced by the placenta is HCG. Is detectable in the blood 1 week after fertilization, like we said yesterday, and 2 weeks in the urine after fertilization. Remember, all the home pregnancy tests are based on urine, so it's 2 weeks. That's as accurate as it can be. What do I need to know about HCG? It doubles every 2 days. That means whatever number you give me today, if we're ever unsure that a woman's pregnant, we'll say, come back in 48 hours. If that number is twice what it was, then she's pregnant. Okay? All right, HCG will double every 2 days, so you get to like week 12 or 14, and then it turns around and goes away. And that's because HCG's job is to control everything in the first trimester. Just remember that. Anything they ask me in the first trimester, I'm picking HCG as the answer. Okay? Because he controls everything in the first trimester. Then the placenta takes over after that. All right? Now, HCG has the same alpha chain as 3 other hormones, which I've already shared with you before. And that was TSH, FSH, and LH. This is why HCG cross-reacts with all 3. TSH, FSH, and LH. So the first one, HCG cross-reacts with TSH. Why? Because mom needs to raise her basal metabolic rate. So it makes sense. She needs higher BMR to do everything for 2 people now. HCG therefore stimulates the TSH receptors so that you get more T4 and T3. But don't ever pick the answer that says mom is hyperthyroid. She acts like it, but she's not. She has elevation of T4 and T3 that's transient. Because remember, estrogen will raise your TPG and then bind it all back up. So her TSH usually does not fall below normal. Because that's what you call hyperthyroid. You got to have low TSH. So elevation of T4 and T3 in the first trimester is due to HCG, stimulating the TSH receptor. Any questions so far? All right. HCG is also the reason why animals eat the placenta of their babies after they give birth. Mammals do that. So like a lion, you take a lioness, and a lioness hunts with the male lion to kill a gazelle. All right. Now, once she's pregnant, her belly's almost dragging on the ground. I don't think you're gonna run after a gazelle with your belly dragging on the ground. So what happens is after they deliver the cubs, she eats the placenta. Why? Because it's rich in HCG, which will then secrete more T4 and T3, and guess what? She'll lose all the weight real fast. Everybody follow that so far? Well, humans are mammals, so then humans started doing the same thing. First time I ever heard about this was in Australia. I was up late one night watching something commercial, someone was cooking. I thought, oh, cooking class or something. And then I heard barely, I'm half asleep. And then it said something about placenta. I'm like, what? Woke me up, placenta. I mean, this one was putting some chopped onions and peppers. And I, damn, when did we start doing that? Well, we started it because now American women are doing the same thing. You guys been hearing about this? Yeah, you can now request that the placenta be put in the jars. You can take it home. You saute it. Because remember, if you overcook it, the HCG denatures, then it's no good. Yeah, they just kind of put in a pan, saute real fast, and put it out. Oosh. Yeah, okay, I don't know. Well, anyway, they got a company now that'll make pills out of it for you. America loves pills. So they'll turn them into pills. That way you just swallow the pills. But it's pieces of the placenta. They grind it up. Anyway, but just to let you know, it does work. Next, this is why HCG was used in the past for diet programs. Maybe some of you guys heard about that. Some doctor started that. Now, when I heard about that, because we had one doctor doing it in our town, when I heard about that, I said, wait a minute. I thought TSH, hyperthyroidism already killed a bunch of women in the past. Why are we doing the same thing again? And well, after a few years, sure enough, the DEA put out a note in all the journals that said, if you're a doctor involved in the HCG diet, stop immediately because we're coming after you. So they gave the doctors a chance to protect themselves, just stop the diet because we already know it's going to kill too many people. All right, so no more HCG diet, but at least I want you guys to see the physiology. All right, next connection. ACG can be used to induce ovulation. Remember, that means I wait till about 2 weeks into your cycle. I give you a big shot of ACG. Your body thinks it's LH. LH surge equals ovulation. It's just that it's not very reliable. Only works like 6% the last time I looked it up. What's the most effective item? Most effective drug for ovulation? Clomiphene is falling down to number 2 now. He's no longer number 1. Starts with an L. Lobster. That's fine. Letrozole. So aromatase inhibitor is now the most effective. Then clomiphene, then leuprolide. Now, what if the ACG starts rising too fast, Adnan? You know, it was 10 yesterday. Now it's 10,000 4 days later. That's definitely not normal. What are you supposed to be thinking about first? What pregnancy is that? Yeah, and then say molar pregnancy. You say pregnancy, that's normal pregnancy you're talking about. All right, so molar pregnancy, remember, if the ACG is rising too fast, fundal height is rising too fast, or I get preeclampsia in the first trimester, rule out molar pregnancy. The most common karyotype seen in molar pregnancy, Gloria, is what? Yeah, remember 46XX, because X's are stronger than Y's. Good way to remember it, right? And incomplete mode, 69XXY. A molar pregnancy, if that ACG is rising way too fast. Okay. ACG is also sky high if you got choriocarcinoma. Remember, that can be a complication of molar pregnancy itself. All right, that's ACG. Any questions on that? So ACG maintains the entire first trimester, and then at 12 to 14 weeks, it dips and then goes away. And then the placenta takes over for itself. So progesterone would then be made by, oh, wait a minute. I forgot to tell you the 3 main actions of ACG. Sorry. The 3 main actions of ACG, I just gave you all the connections to clinical, but I didn't tell you what it actually does. All right, the first job of ACG, maintain the corpus luteum production of progesterone. Remember, without that progesterone, there's no blood, there's no nutrition for the baby. So in case they ask you, that's the one you have to pick first. It maintains corpus luteum production of progesterone, which then maintains the lining, coiled arteries, lipid, and glycogen deposition for that baby. That's his number 1 job. Number 2 job, increase GI motility and absorption, because we're doing everything for 2 people now. Mom is eating for 2 people. So it makes sense. Increase GI motility and absorption. This is why if you're pregnant, Karina, you wake up in the morning, remember at night, your hormones dip, right? They go stored away. In the morning, your hormones rise. This is why when a woman is pregnant, early morning vomiting, morning sickness, that's ACG. Because every morning, GI motility rises. And a lot of salivation, a lot of vomiting every morning. And if you get too much of that, then she ends up in the hospital with an illness called hyperemesis gravidarum. Which just means a pregnant woman with a whole lot of vomiting. Hyperemesis gravidarum causes severe dehydration. What fluid do you want to put them on, Chris? You want to put them on normal saline. However, in the old days, there was no normal saline. So what they tried, somebody tried a drug called DES. See, sounds familiar. DES, diethylstilbestrol, is a real potent estrogen. They thought maybe feedback inhibition can block the HCG. Not only did it not work, but following these women long-term, they found that the daughters of the women who participated in the study, now, not the women in the study, their daughters had 3 problems. Number 1, incompetent cervix. I always think of estrogen softens up the cervix, so it makes sense to me. So a lot of their daughters lost their babies. Incompetent cervix. Number 2, adenomyosis. Remember, I gave you this yesterday, adenomyosis. And then number 3, clear cell vaginal carcinoma. So 3 bad associations with DES. Again, in the daughters of the women who participated in the study, not the women themselves. But now, once normal saline was invented, not even a problem anymore. Because we just give them normal saline, hydrate them overnight, send them home the next day, and then they're fine. Most of them can even stay at home and drink Gatorade or Pedialyte, and they're okay. But hyperemesis gravidarum, when they come in, Justin, and I check their electrolytes, their sodium is going to be, low? Why is it low? All right. I said, what do you think? Sodium is going to be low? Why? Yeah, you got to give normal saline, but why is their sodium low before I even give the normal saline? Saba, any idea? Why is their sodium low? Somebody just told me sodium would be low. I'm saying prove it. Yeah. All right, Karina. So she's saying that the person is losing sodium through the vomit. Is that what you're saying? All the electrolytes. Yeah, you can say it that way. That's partially true, but it's just low volume state. Aldosterone dilutes everything. Yeah, dilutional. So if you're asked on a test, just say dilutional. It's aldosterone that's doing that. Remember low volume state. This is just another name for it. Okay. Low sodium, low calcium, low chloride. The same profile, folks. Metabolic alkalosis. That's what I say. Make sure you know your patterns. Otherwise, you got to look up all these diseases every time they ask you about it. You don't realize you already know it. Okay. All right. So that's HCG. Any questions on that? Hyperemesis gravidarum. So early morning vomiting is a classic early sign of pregnancy. And now you understand why that is. All right. So increased GI motility and absorption. And then number 3, increase basal metabolic rate by stimulating TSH receptors. So that's the 3 main jobs of HCG that they want you to know. Lawrence? Yeah. HCG is produced by syncytial trophi, which is the placenta. Yes. For the first trimester, it takes care of the entire first trimester. After that, the placenta will make its own hormones. Yeah.
So already on day 1 of implantation, it's already secreting beta HCG.
Yeah, you just can't measure it till day 7. Yeah. Yeah, that's what's keeping the corpus luteum alive. Yeah, you got to have it. Yep. But we can measure in the blood at 7 days out, measure in the urine 2 weeks out. All right, progesterone comes out and then does a whole lot of things. All I want to hear is some of the things that you guys have learned. What can progesterone do? Give me one action. Daily. Keep up the spiral arteries, lipid and glycogen deposition in the wall of the uterus. All right, Solange. Keeps the uterus from contracting. Okay, it is a slight muscle relaxation. All right, that's fine. So it keeps the uterus from contracting because right now we want plenty of room for the baby. All right, Meha. Increased appetite. Progesterone is one responsible for the increased appetite that pregnant women have. That it makes sense because they're eating for 2 people now, right? And progesterone is also responsible for pica, strange cravings. Strange cravings. All of a sudden they have these cravings for 2 things that got no business being together. But you don't argue. And they always want it somewhere at 2 o'clock in the morning. And you don't argue about that either. Just go to the store, get it, put it down on the table, and just walk away from the table. Don't look back and don't ask why. All right. You can tell I was traumatized in that pregnancy. Huh? But anyway, I'm trying to tell you, girl, hey, what are you going to do, right? I remember times I show up at Jules. It was a Jules right down the street from my house, 2 o'clock in the morning. I'm walking into buying 2 things. All of a sudden, another guy walks up. You too? Yeah. I mean, we're just looking at each other. Damn, why at 2 o'clock in the morning all the time? What are you going to do? You just got to go get it. And don't argue. Don't say a thing. Okay? Anyway, that's progesterone, pica. Anything else that progesterone is going to do? Montessori. What? Libido? Yeah, progesterone increases libido for a female. This is why pregnant women get this desire to suddenly have sex all the time. All right? It's true. And they'll call you and say, hey, I'm worried about my baby. What position should I use? And see, when you guys are uncomfortable with sexuality, somebody asks, what position should I use? And all of a sudden, well, all of a sudden you get uncomfortable. That's when they realize you have no idea what you're talking about then. All right. The two positions that we recommend that they use is number one, both people on their sides. So her on her left side, because we don't want pressure on the IVC. Her on her left, him on his left from the back. Easy position to use. I don't know what name they have for it. We just describe it. All right. And then the second one is her on all fours. All right. I've been looking for a medical term for doggy style. I ain't found it yet. I'm serious. I even had students, please find me a medical term for this. Nobody's found it, so I'm just describing it for you. That's what it is. Okay. The reason is when she's on all fours, the uterus swings forward and he's penetrating from the back. That way it doesn't bother the baby. Okay, so the visual works for me because I understand why they actually recommend that. Those are two positions we recommend. That means no him on top. That's not good. He's smashing the uterus if he does that. So we always tell him you can't do that. Okay? Yes. What would the name be? Coitus caninitis? Is that like canine? Coitus caninitis. Oh,
Hello,
dog. Man, please get out of here, man.
So I think I know the medical name of that doggy
You're
style.
just making
Sir.
stuff up over here. Oh, Mabel
Guys,
got a medical name for it?
Yeah,
Mabel, what's the medical name?
it's pendulum.
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 That's what it's called?
Yes.
What?
Hey, let's start calling it pendulum now. That's what I mean.
No, we got somebody else confessing over here. Okay, who else is talking? Who gave you that advice, Mabel? Who was that? That was Olivia? Olivia,
yeah,
you read that
Kuma.
somewhere? Oh no, you just proposing that. Okay, I have no idea.
Yeah, it's Kuma.
Anyway, those are the two positions, folks, just so you know. All right, something else that progesterone does. Andres. What? Increased blood volume. Hematocrit for a person equals RBC volume, RBCs over volume of plasma. That's hematocrit. All right. So blood volume, as Andrew said, is going to go up 50%. Sorry, 50. Well, progesterone also mimics erythropoietin. It has the sequence of erythropoietin in it. So RBCs go up by 30%. So what happens to the hematocrit of a pregnant woman, Sandra? Go up or go down? What? I can't hear you. Go up or go down? No, look at that percentage. It went down. That's a percentage. That's a fraction now. So this is the normocytic neurochromic anemia seen in all pregnancies. The last should explain it. It's dilutional. It's not even real. That's the trick to the question. All right. Students will pick iron deficiency. The question says normocytic neurochromic. Iron deficiency is not normocytic neurochromic, but they knew you'd be attracted to it because you know iron deficiency occurs in pregnant women. Or folate deficiency. I'm telling you, test writers know what will attract your brain. And that's why I say you got to think it before you look down. Otherwise, you're going to fall for a lot of tricks and not even realize you fell for the tricks. Okay. It's dilutional. It's not even real. Okay. But this also helps you understand why a female produces extra blood every month that she's going to lose every month. See that? Progesterone is wrong for that. Okay. All right. A few more. All right. Ree, anything you know that progesterone can do? Anger. Progesterone, just similar to testosterone, right? Produces anger, agitation, and violence. Oh, man. I don't know what to do with that one. Anyway, it's 1 minute she loves you, next minute she hates you. I don't know what's going on. Anyway, we'll talk about estrogen first, and I'll show you what happened with my baby. All right, so progesterone increases anger. All right, anything else, Amy? Decreases gallbladder contractility. Estrogen is a muscle relaxant too, so it's a double whammy. This is why pregnant women have increased incidence of gallstones, see that, and gallbladder disease. So any pregnant woman with right upper quadrant pain, come on, just click the same answer. Don't worry about it. It's almost always the same answer. All right, Gustavo, anything? Acne. Progesterone stimulates propionic acid, which is what propionibacterium likes, the guy who causes acne. Yeah, so that's why acne gets worse when you're pregnant. That's why acne gets worse in women each month. I remember there was a young lady here years ago. She had bad acne, but every month she would just have a bad outbreak. I mean, it was just so noticeable, you know? So, excuse me? Pregnancy glow, we're coming to that glow. Yeah, but the glow can't hide that acne though. Yeah, just so you know, it's not gonna hide acne. Yeah. Yeah, that's because of the other actions. Yeah. Some get the bad ones, some get the good one. The key for you as a doctor is just know all of them. And then that way you can explain it to any woman who's asking you, well, how come I get this? How come I get this? And then you can say, hey, progesterone did that. All right. So anyway, progesterone. So it causes acne. Progesterone also stimulates melanocytes. That's why you get hyperpigmentation when you're pregnant, right? So they get hyperpigmentation along the malar area. We call that melasma or cloasma, also known as the mask of pregnancy, because she looks like she's wearing a mask. Or some books that say she looks like a raccoon. But you don't say that to your wife. Please don't say that. All right. But it's normal. It's normal. Okay. The pigmentation. But that means look at the lifelines on the hands become really dark. Remember, I was saying before, mom in Nigeria, she can tell when her daughter's pregnant. Just look at the hands. And you know, they stick out your hands, stick out your hands. And they stick out the hand. Aha, you're pregnant. The moms know. You can lie all you want. She can tell you're lying because it gets real dark. You're pregnant. The areola gets real dark. The stretched skin, the stretch marks get real dark. The line right here in the middle of your abdomen gets real dark. Any old scars get real dark. There's all kinds of medical terms, but you don't have to memorize them. But they'll give you they'll just say hyperpigmentation all over the place. That is a normal part of pregnancy. Progesterone does that to you. All right, Ashlyn. Does progesterone have to do with increased hair growth? That's from increased blood supply to your hair. Yeah, I'll talk, but that's more estrogen than progesterone. Yes. Are there any what? No, you still see the hyperpigmentation. It gets so dark that even on a black person, you can still see the lines are darker than usual. Yes. Yeah, the more pigment they can actually deposit in those lines. Yeah. Leslie, you have a question?
Yes, I didn't catch up the relationship with progesterone and increased risk of gallstones formation.
Yeah, progesterone is a smooth muscle relaxant, as is estrogen. So that means you're going to have the gallbladder, you're sitting there with a lot of cholesterol that's not moving. That's why pregnant women are at risk for gallstones and cholecystitis.
Okay, got it. Thanks.
Yeah. So progesterone stimulates your respiratory center. Remember, we said before, respiratory alkalosis is a blood gas for every pregnant woman. So they love to ask that question. What's the acid base problem seen in all pregnancies? Now you know. Because you're breathing faster, blowing off CO2. CO2 is an acid, pH is rising. Respiratory alkalosis, the blood gas for all pregnancies, no exceptions. Any questions so far? These are just the actions of progesterone. That's all I'm giving you. All right, progesterone does all that to you. All right, now progesterone is a precursor for aldosterone. If you remember 21 hydroxylase and 11 hydroxylase, progesterone is actually the precursor. And so that's why you have excess aldosterone when you're pregnant. All right, which means you have excess water that you're holding on to. That's why she's swollen. All of a sudden, her shoes don't fit anymore. Her rings don't fit anymore. Nothing's fitting anymore. Then she gets mad as hell at you. This is your fault. I can't fit into my clothes. I can't fit into my shoes. I can't fit into my hat. You did this to me. Okay, honey, I love you. Okay, thank you. You got to diffuse the situation, man. Diffuse the situation. Anyway, that's progesterone. Let's go to that. All right. Anna. Yeah. No, that's not either. respiratory alkalosis is the blood gas for a number of pregnancies. You understand? If I don't see respiratory alkalosis, then something's wrong. That means the progesterone levels are too low. All right. The other thing that progesterone will do for you is lengthen the cervix of the uterus. It gives a nice canal for the baby to come on out. And that's why if a woman does not have a long enough cervix means you need at least 2.5. That means 2.5 centimeters, which is 25 millimeters, to be adequate. It's got to be at least that. If not, we put a little progesterone in that cervix and it lengthens it for him. All right. Did you have another question, Nana? You're still looking confused. No, the person would be acidotic. And we know that that's not pregnancy. That means there's something else causing it. Yeah, it's still going to be acidotic patient, just like anybody else. Yeah, but the key is I expect respiratory alkalosis and all of a sudden I see acidosis. I know something's wrong with this woman. That's why you always want to know what normal is. This way you don't react to normal, you react to abnormal. All right, so normal blood gas is not normal in a pregnancy. Okay, respiratory alkalosis is normal. Akshay, do you have a question? Yeah, all right. Aldosterone gets rid of hydrogen, so you can have metabolic alkalosis that way as well. All right, so that's progesterone. Estrogen now. Estrogen does a lot of things. Let's go. Let's see where we left off. Ida, give me something that estrogen does for you. Relaxes smooth muscle. So estrogen is responsible for why blood pressure falls. That's one of the reasons for why blood pressure falls when you're pregnant. Low blood pressure is the norm. Even normal blood pressure, 120/80, is high if you are pregnant. Don't forget that. See, again, you got to know what normal is before you can figure out an abnormal person. Okay, 120/80, that's what they put on there. And then you forgot she's third trimester pregnant. How are you walking around with 120/80? That's hypertensive for a pregnant woman. Okay, yes. Yeah, that's the other contributor. You're increasing remember, you're adding like 1 million capillaries to a parallel circuit. So TPR has to come down. All right. Vasodilation is also why blood flow goes straight to her skin. And then they get that glow of pregnancy. And see, you get that glow. So, girl, you got that glow. But that glow, extra blood flow to your skin, means skin cells, dying skin cells will slough off. That's why your skin looks so fresh. See? And then new skin cells will come in. That's why you look so fresh. So if somebody says, oh, you look so pretty, you look so glow. You say, well, I can give you that glow too. Really? How do you do that? Slap her twice. All right, there it is. A whole lot of blood flow comes right to your face. I'm just playing now. Please don't do that. Tell them Dr. Francis said slap you twice. I didn't say that now. All right, but anyway, the glow is just vasodilation. That's all I'm telling you. It's just vasodilation by estrogen. All right. This also explains why they have telangiectasias. It's vasodilation. Reflux and GERD, vasodilation. See that? Constipation throughout the pregnancy, vasodilation, muscle relaxation. Urinary retention, muscle relaxation. See that? Enlargement of the uterus, muscle relaxation. See that? Everything makes sense. Why do they get UTIs? Urinary retention. How about hemorrhoids? Muscle, see that? Vasodilation. Varicose veins. Now you know. Increased risk of DVT and PE throughout the whole pregnancy. Now you know. See? What else can estrogen do? Let's go to Lawrence. Proliferation of the endometrium, I'll give you that. So proliferation of the endometrium. Remember, we're talking about just during the pregnancy. All right. Nolan, another action of estrogen. Cause the liver to produce a whole lot of proteins. This is why your sed rate would be higher when you're pregnant, or your sed rate is higher when you put on birth control pills, or your sed rate is higher when I put your tamoxifen, raloxifene. Anything that mimics estrogen, your sed rate goes up immediately. Cynthia. Increased TBG. I told you before, that's the one they're going to ask you about. Because she's going to call you and say, hey, what do I do now? How's this going to affect my thyroid problem? I've seen that question a bunch of times on all the question banks. Because you got to know, because if you don't, she's going to be hypothyroid. And if she aborts that baby, it's the doctor's fault. Because remember, without the permissive hormone, things just stop working. That means the baby stops developing too. All right. So TBG will rise. So total will rise, but free T3 will drop. That means you got to tell her, take more and see me in the office in 3 weeks, then I'll recheck your TSH. So TBG. All right, Angie, give me some of the estrogen you can do. Suppress the immune system, as trial especially, E3. Suppresses the entire immune system for a pregnant woman. That's why the pregnant woman is the only time you treat every case of asymptomatic bacteriuria. They'll give you like 500 E. coli, treat. I don't care if it's only 10, treat. Because she has zero immune system. You know, it may only be 10 E. coli, but tomorrow it may be 500,000. And then boom, she's got overwhelming sepsis and dies from it. That's why they tell you always treat asymptomatic bacteriuria. Don't go by her symptoms because we check the urine every time she comes in. Okay. Anytime you see bacteria, you must treat it. Okay. Antibiotics we like in pregnancy, penicillins, cephalosporins, macrolides, nitrofurantoins. It's easy to just tell you the 4 we use, and I mean, everything else, no. Karis? If the pregnant woman doesn't have an immune system, all the immune cells are downregulated. So if she had an autoimmune disease, would she get better or worse? No, she get better. Inflammatory cells got to come out of bone marrow. So that's why every autoimmune disease gets better with pregnancy. Pregnant women with like rheumatoid, oh, they love being pregnant. It's like 9 months of bliss. Better than methotrexate, better than TNF drugs. Okay, but there's only one disease that gets worse when you're pregnant, and that's lupus. That double-stranded DNA antibody is so severe. The body recognizes it and will attack it. Even if you're suppressed, it'll still attack it. Lupus is the only disease that we know that still have a flare-up during pregnancy. Any other disease they ask you about, folks, just say they're going to get better. And that's another question I've seen many times. Yeah. Was it harder to treat pregnant women with COVID? Yeah, because they don't mount much of an immune response. So that means here's COVID ravaging their body and they're not doing anything about it. That's because immune cells don't want to come out of bone marrow. She's suppressed right now. Yeah. Remember, that's why first 2 people that were supposed to be immunized, remember, pregnant women and elderly. Yeah. So it makes sense. All right. So what's your second question? Go ahead. Yeah, you have increased respiratory rate. That's what causes respiratory alkalosis. Yeah, progesterone does that. Cesar. In RH incompatibility? Well, how does it happen? Again, it's just like lupus. It means that it's so foreign to the body that it still was able to get the immune response to respond. Yeah, double-stranded DNA, the body's never seen. What the hell is this floating around? Double DNA floating around in the bloodstream? And that's why the body will still find a way to attack it. Yeah. All right, so estrogen. Now, the proteins that come out of the liver, let's go on that. So
Dr. Francis.
High. Who's speaking?
Hi, it's Brenda.
Brenda, what's your question?
I have a question regarding pregnancy and lupus. It is double-stranded antibody is not cardiolipin, the one that is doing the clots and everything?
Yeah, cardiolipin antibody is one that causes clots and also causes bleeding. Yeah, what about it?
But the worst one is the double-stranded or the cardiolipin in pregnancy?
Oh, no, in pregnancy is the cardiolipin. Because remember, it can cut off the entire placenta and cause abortion. It can cause venous and arterial clots. Yeah, that's the worst one in pregnancy.
All right, thank you.
All right, no problem. Other thing that happened, remember, so we did TBG, we did clotting factors. So increase in clotting factors, right? You got veno and vasodilation, right? You got stasis already throughout your body. And here now, I put a whole bunch of clotting factors floating around. Everybody see the risk. Yeah, cardiovascular risk throughout the whole pregnancy. You can't help it. But remember, the cardiovascular risk is the highest right after the placenta is delivered. Don't forget that, okay? Because that's what they like to ask. Well, when is the risk the highest? It's not even throughout the pregnancy. It's when that placenta separates and you got a million capillaries that just subtracted from a parallel circuit. Now she's in big trouble. You know, so postpartum preeclampsia, remember, intracerebral hemorrhage, number one cause of death. That's how bad it is. All right, it comes on so quickly, so severely that it ends up killing a woman. All right. So estrogen, it's a lipoproteins. This is why triglyceride levels go higher when you're pregnant. This is why they get fatty liver when they get pregnant. And fatty liver of pregnancy can become severe enough to shut down the entire liver. How do I know that it has developed in the woman? Well, they'll give you low glucose or high ammonia levels, which means urea cycle shut down, gluconeogenesis shut down. Okay. So fatty liver disease of pregnancy can actually shut down the entire liver. So something to watch for. But this also explains why they have gallstones, especially after the pregnancy, because all that cholesterol now get mobilized to gallbladder. All right, this is why they get lipid deposition, right? Xanthelasma, xanthoma, right? Recurrent pancreatitis, now possible. And what else? Tendinopathies. Remember, it's lipid deposition along tendons that cause these problems. So carpal tunnel and decrevit veins are the top two in pregnant women. Estrogen. Well, estrogen makes a female feel very emotional, mellow emotional. Remember, progesterone makes you feel angry and agitated. So you never really know who you're dealing with at any time. One minute she says she loves you, and I say, I love you too. She said, why didn't you say it yesterday? I didn't say yesterday? Okay, I love you from yesterday. Okay, thank you. Well, you need to say it every day. Okay, honey, I'll say it every day. Okay, thank you. Next minute, I want to kill you. Going for my throat. I don't know if we're fighting or not fighting. I didn't know what the hell was going on. Man, it was not just my wife who was pregnant. Both of us were pregnant. Both of us were pregnant, man. I've never gone through 9 months of hell. All right. When I first got married, I wanted 8 children. Yeah, 8 is normal in Nigeria. Come on, 8 is nothing. All right. So I thought I want 8 children because there was 8 in my family and 1 died. You know, she said, no, 2. I said, no, honey, you don't understand. I need 8. She said, no, 2. So as time went, I thought, okay, I'm going to get progressive. I'm going to compromise. I said, okay, babe, how about 6? There I got my own basketball team with 1 sub on the bench. She said, no, 2. Well, I said, okay, fine, let's get started. 9 months of pure hell. I had no idea women go through such emotional roller coasters. Now, this is my wife. This is not every woman, obviously, but mine went through it. Woo, my God, I've never seen most roller coaster because you're normally a mellow person. And I mean, 1 minute she's angry, 1 minute she loves me, next minute she wants to choke me, next minute she's chased me with a knife. I'm telling you, I didn't know what the hell was going on. You know, I thought we were going to be divorced before this baby comes out because I thought she hated me. Whenever she went through these angry fits, she truly wanted to kill me, you know? And at the same time, when she's ready to kill me, also you hear, I said, damn, there's a Chucky in my house, man. I said, what the hell am I being with here? Miss Chucky's living here with me. I said, no. After we had this one, because she had one from previous marriage, after we had this one, I went to the doctor. I said, Doc, cut it, snip it, burn it, tie it up. I said, that's it. I don't even want an accident to happen. I couldn't believe it. Going from 8 to 1, I said, I'm done. I'm done. Man, because right after she gave birth to my son, she went back to another mellow self. I said, whoa, hormones did this to you? I said, no, I can't do this no more, man. 9 months of pregnancy, I can't do it. I said, I can't do it. Oh my God, I'm so done. Anyway, that's not the way every woman responds. Mine was, man, she was a maniac with all those hormones. All right, Brenda Rivera, you got a question? Brenda, do you have another question? Okay, Mabel, did you have another question?
Yes, sir. So please,
Yes.
you said that the estrogen increases blood clots. So does it cause vasoconstriction or dilatation?
No, vasodilation, that's estrogen. So you're
Okay.
getting stasis. And then you're getting increased clotting factors, which is another accident. That's why then clots can happen anywhere. All right, Cesar? Are any cancers going to get worse when you're pregnant? Of course they are, because your immune system is not existent. Remember, immune system goes after cancer cells too. Yeah, if she has a cancer, it's going to get worse. Can you get more melanoma? Well, just in general, you can get any cancer. So it's not just about melanoma or anything else. Any cancer, yes, gets worse. Okay. But they say ignore the history of pregnancy. If she comes in with a cancer, you got to treat her like anybody else. Yeah, because if you don't, she'll be dead right before the pregnancy's even over. All right, so as trial. Now, human placental lactogen. So after sometime in the third trimester, the placenta starts making human placental lactogen. This guy blocks mom's insulin receptors, Mitchell. If you block mom's insulin receptors, what happens to mom's insulin levels? You're blocking the receptor. So you're creating insulin resistance. So her insulin levels, hyperinsulinemia is the norm. What happens to her glucose, Mitchell? No, increase because the receptor is no longer working. Remember, I just said it's blocking the receptor. Everybody else following this? This is a one that causes gestational diabetes. That's what they're going to ask you. So you get hyperinsulinemia, insulin resistance, which then leads to hyperglycemia, hyperlipidemia. Same thing we talked about in biochemistry. Now, as the baby is doing this, why is he doing it? Because he wants the concentration gradient to be high enough to come across the placenta to him. He's actually wants that to come to him. Why? Because he's packing his lunch. He's leaving soon. So he wants to stuff glucose wherever, remember, in the liver, intestinal wall, the heart, all those places that need glucose or glycogen stored away. Store lipids everywhere that your body needs it because he's going to be leaving soon. So it makes sense. The problem is gestational diabetes. The best treatment is insulin, right? Because it's the safest one. And then metformin now has been approved for it. That's the only two drugs you can use for gestational diabetes. And then if she develops gestational diabetes, what's the risk of getting type 2 diabetes after the pregnancy? Gloria. What percentage of them? 10%, because that's one risk factor. Don't forget these patterns now. Yeah, 10%. So for that reason, they say do oral glucose tolerance test. All right, or fasting blood sugar 2 to 3 days after the delivery, and then repeat again in 2 months. That way, if things are still off track, then you know she's going to be a type 2 diabetic from now on. Lawrence. Why are we giving insulin if the insulin receptors are blocked? Same reason why we give insulin to type 2 diabetics. The same problem. That's because we don't know what else to do. Seriously. All you're doing is using concentration gradient to get more of an action, and it works. Same thing in type 2 diabetes. Their receptor is not working. Why are we using insulin for them? We don't know what else to do. Till somebody else come up with another drug that can do it. Insulin is still first line. All right, so HPL. Then inhibin comes out throughout the pregnancy. What's that supposed to do? Inhibit what on them? Inhibin inhibits what hormone? FSH. That way mom cannot start another cycle while she's pregnant, which makes complete sense. Okay, she's pregnant. She has to focus on that pregnancy, not on any more cycles. Relaxin comes out, especially in the third trimester, to relax all tendons, ligaments, and cartilage. That's why a pregnant woman's hips just stretch way out like that. And that's why if a woman has too many large babies or too many babies in general, the wide hips just stay on them. Is this another reason why you can't get a zipper? Yeah, because that'll mess with the cartilage. Yeah. We don't use quinolones in pregnant women for that reason. Relaxing. Now, it also helps the pelvis to stretch so that the uterus falls down closer to the vagina for the baby to exit. Makes sense again. Relaxing. And then oxytocin is released when it's time for labor. Where's oxytocin made, Melissa? Where? Oh, yeah. Catch yourself next time. Be careful. It's only stored in the posterior pituitary. It's not made there. It's made in the hypothalamus, supraoptic and periventricular nucleus. All right. So the hormones of pregnancy. All right. Now, let me just go through them again. This is just to remind me in case I missed anything. So AC, typically in blood 1 week after fertilization, a year and 2 weeks after. So all pregnancy tests are based on 2 weeks. Has the same alpha subunit as FSH, LH, and TSH. So check beta. That's why we don't check alpha HCG, because you'd be measuring 4 hormones. 3 actions: maintain the corpus luteum, production of progesterone, to maintain that lining. Second, increase gamma-10 absorption. That's how you get hyperemesis gravidarum. And to sensitize the TSH receptors to get more T4 and T3. Maintain a corpus lutein production of progesterone can lead to hyperemesis. Oh, sorry, I just said all that. And then DES exposure we talked about. The 3 complications of DES exposure in the daughters of the women who took DES. Remember, there's always going to be an answer that says in the women who took it. That's not the one you're looking for. And then increases basal metabolic rates. Doubles every 2 days until week 12 to 14 and then goes away. And ACG, oh yeah, I forgot to give you these 2 numbers. ACG of 600, you got a viable fetus. Once it hits 2,000, you can see it on abdominal ultrasound. Until that time, between 600 and 2,000, that's what the vaginal probe for an ultrasound is all about. It means the sac is so small, you need the probe to go in there to find the sac for you. If you do it from the abdomen, you're not going to see it. So vaginal probe for pregnancy is when ACG is somewhere between 600 and 2,000. The baby's too small to see from the top. How to follow first trimester? Fundal height rises 1 centimeter per week. I gave you the 2 landmarks. Pubic symphysis, 12 weeks. Umbilicus, 20 weeks. ACG doubles every 2 days. Estriol levels rise linearly. If the baby dies for any reason, remember I gave you estriol levels will fall off first. And then you verify it with an ultrasound. And what do? Help mom deal with the loss and then deliver the baby the next day with a little bit of oxytocin. Think of molar pregnancy if fundal height is growing higher than expected, ACG is rising faster than you predicted, or hypertension in the first trimester. Complete mole, karyotype, 46XX, because X's are stronger than Y's. And incomplete mole, 69XXY. If you remember, it's 2 sperm that fused at the exact same time with the living egg. And so all 3 got incorporated. Progesterone increases respiratory rate from PONS. That's why respiratory alkalosis is the blood gas for pregnancy. Increased appetite. Pica, increased red blood cell mass by 30%. Increased plasma volume by 50%. Causes acne, hyperpigmentation, chloasma, melasma. Again, make sure we talk about all of those. Estrogens are smooth muscle relaxing. That's the big deal. So it connected us to a lot of things. Stimulates protein synthesis in the liver. So that's why the set rate is higher when you're pregnant. Hyperlipidemia, so it explains the hypertriglyceridemia, the fatty liver of pregnancy. Increased DBG, make sure you tell her to increase her thyroid replacement and then recheck it in 3 weeks. Increased angiotensin, if you remember we talked about that. This is how you get preeclampsia. If you have any ischemia of that placenta, the placenta releases renin-like substances and boom, now you activate all this angiotensinogen and then boom, we got preeclampsia. It increased clotting factor. Inhibin blocks FSH, so you cannot start another menstrual cycle while you are pregnant. And then HPL blocks mountain insulin receptors, creates insulin resistance, and that's how you get gestational diabetes. Treatable, insulin first, metformin second. But it's going to cause type 2 diabetes in 10% of those women. So we check glucose tolerance test or fasting blood sugar 3 days after the delivery, and then again 2 months after the delivery. Yes. It's coming from the placenta. Yeah, inhibin. Yeah, placenta. Relaxin relaxes tendons and ligaments, so it stretches the pelvis, which is why the hips of a female gets bigger and bigger the more babies she has. But as long as she exercises after the pregnancy, it will all go away. And Karis has a question for me. A woman is having a vaginal birth, you say? Okay.